My name is Denise Stinson, and I am currently enrolled here at Ashford University, majoring in Health and Human Services. For this assignment, I would like to speak to you on the topic of telehealth, which is a component of health informatics. Telehealth includes all the methods utilized to enhance the delivery of health care. With increased technology, we now have the ability to support clinical health care remotely by providing virtual medical, health, and education services. With the development of telemedicine in healthcare, there may be legal or ethical issues if security measures are not in place to protect the sharing of health information. In addition, in certain situations, there may be licensing factors when health clinicians are not licensed in the state where the patient is located. Associated laws vary from state to state. However, some states require the patient to provide an informed consent form before a provider can even use telehealth. This particular requirement is required by state regulation, and particularly with the Medicaid population. In addition, there may be some reimbursement issues for providers that provide telemedicine services. Telehealth can have an impact on the healthcare delivery system by supporting a patient's understanding of his or her complex comorbidities, increasing the patient's compliance with the medication, dietary, and/or treatment regimen. Patients that are residing in remote areas will therefore have easier accessibility to obtain clinical services, therefore resulting in improved outcomes and reducing their overall health care costs, thus preventing a probable admission. Best practices allow facilities and organizations to utilize their established data collection tools for data abstraction in the EMR. Thus, reports can be run to obtain data and establish outcome on improvement initiatives. For example, instant data entry applications, which is used in most insurance companies for abstracting the annual health HEDIS measures. Telehealth is slowly becoming a standard benefit provided by most insurance plans such as Cigna, Blue Cross, and Aetna insurance plans. A specific example of telehealth in healthcare is existing telehealth nurse jobs. Nurses are needed to provide the triaging of a patient's clinical needs. The telehealth nurse provides opportunities for care coordination, scheduling and appointments, as well as for the patient to have labs or diagnostic screenings. The telehealth nurse also performs a multitude of other duties. From a managed care perspective, telehealth nurses regulate the access to the EMR with the goal of reducing trips to the emergency room. There are many career opportunities in telehealth as the role of telemedicine continues to evolve. As a telehealth nurse, I would utilize the opportunity to focus on education on one of the chronic health conditions, such as diabetes, to enhance the patient's overall experience and decrease their health care costs. I hope that you found this information interesting but yet useful. Thank you for your time.